All right, so contributing factors to dysfunction, we have psychological and emotional stress. We have physiological factors, which we'll talk about in this slide, and then also the slide after this. We also have regional interdependence. So we as clinicians focus not only on the actual injury itself, but we try to take a more global approach to pain and dysfunction. McCoss et al., this article had 17 healthy participants. They did a sham treatment and then a diaphragm release treatment. They tracked prior to and then after treatment pain pressure threshold on the C4 paraspinal musculature and then tibialis anterior as well. So the treatment that they did for the diaphragm release, it was different than the primal reflex release therapy diaphragm release. So they used their thumbs, and during the exhalation phase, they kind of dug underneath the ribs, but they didn't have them hold their breath or perform any similar, instructions to the PRRT release. The after effects, the post measurements were actually lower than the pre-intervention measurements for pain pressure thresholds. So that actually supported their hypothesis that this would have a hypoalgesic effect, decrease somatic dysfunction, and along the gait control theory that they were trying to determine if that was even possible to decrease pain pressure threshold pre and post treatment with just the diaphragm release. We have psychological and emotional factors, stress, anxiety, trauma. We're going to take a look really quick. There's a lot of literature out there for women in labor. There's a outcome measure specifically for women in labor, the stress anxiety inventory, and actually the use of Lamaze classes, practice, breathing instruction actually helps decrease the perceived pain level and anxiety experienced during labor. Now, there was a lot of comparison studies to women who received Lamaze, women who did not, and they kind of came down to it that breathing actually helped cope with the uterine contractions and decrease anxiety overall, so that was pretty cool. Physiological factors, disease, diet, lifestyle. Are you sedentary? Are you active? Are you not? Hormonal and environmental influences. So all of these can be contributing factors to breathing pattern dysfunction.